Dr. Satava will introduce Honorable Casscels.
Well, I realize that our troops in Afghanistan and Iraq cannot see me, but I would also like to add my thanks to the troops out there that are serving us so well, protecting us here in the United States. It's my distinct privilege to be able to introduce the former Assistant Secretary of Defense for Health Affairs, Dr. S. Ward Casscels. He is currently the John Tyson Distinguished Professor of Medicine and Public Health, as well as the Vice President of External Affairs at the University of Texas in Houston. Dr. Casscels' team, when he was doing his research, goes all the way back to the original work that was important in understanding coronary artery disease and the role of inflammatory process in that. It's been revolutionizing the way that we've been looking at cardiology and cardiac disease. His tenure as the Assistant Secretary of Defense was from April of 2007 through just this past April. He just retired when Dr. Charlie Rice from the Uniformed Services Medical School has now taken over. He has many different accomplishments. While he was the Assistant Secretary of Defense, he was credited actually with turning around our military health care system from his legendary experience in public health policy as well as clinical medicine, which was unique for most of the secretaries that came here. For those of you who are not aware, the military health system is a $45 billion healthcare system with 137,000 employees, 10 million patients with 900 clinics and hospitals in 100 different countries around the United States. Dr. Casscels has received the highest defense civilian award, the Distinguished Public Service Medal, quite a credit, which many other ones, including the Order of Military Medical Record. And all the time while he was the Assistant Secretary, he would be making rounds with the soldiers there at Walter Reed, giving them his advice and counsel. Once again, almost unique when it comes to previous secretaries of health. He is a graduate of Yale as well as Harvard and Harvard School of Public Health. And currently and previously he has been working in the areas of heart attack and stroke, information technology, medical ethics, flu, disaster preparedness, nanotechnology, healthcare management. So he's got a wide wealth of experience as well. I think one of the things that he's proudest most of was the acclaim that he had for his recent book called When It Mattered the Most. And this was a tribute to the medics that were killed in Iraq and Afghanistan. And it was termed by Newsweek's magazine as a most noble work. So it is a great privilege for me to be able to introduce Dr. Ward Casscels, former Assistant Secretary of Defense for Health Affairs, who is now living exile in Washington, D.C., exile from his home state of Texas. Thank you, Dr. Casscels.
Thank you, Dr. Satava. I really enjoyed watching Dr. Ali. I know you did too. And it's amazing how fresh a guy can be, having been up since 0500 or something, other side of the world. And now it's nighttime over there, and he's still on fire about what he's doing. And also very quantitative, very realistic about what he's doing. I found that talk inspirational as I expected, and also eye-opening. You all know the story of the bishop, a very important bishop that comes to the little parish church once a year to give a sermon, resplendent in his robes, and he takes his watch off and puts it there on the lectern, and the little girl in the front row turns to her mother and says, what does that mean? And the mother, who's heard the bishop the year before, goes, absolutely nothing. Well, I intend to stay on time, but I want to say a few words about things that are on my mind, and some things that were difficult to say when I was in office, and some that need repeating, things I did say to make them stick. Thank you all for being up so early, particularly our military colleagues. As a Army reservist who was deployed to Iraq and before that to Kuwait and Qatar and Thailand, I know what it's like when you have to get up at 0500 to do your PT on a Saturday and be at a meeting at 0700. Thank you for doing that. The civilian doctors sometimes have trouble understanding why military doctors are so fit, or why there's a standard of fitness, but when you do get deployed over there and you have to work incredible hours and carry a couple of big sea bags around and rucksack and rifle or pistol and all that, you realize what the fitness is all about. Let me tell you a little bit about where military health care has gone in the last few years. We've been blessed by a Secretary of Defense, Bob Gates, who cares deeply about the welfare of warfighters and their families, and also the retirees. I couldn't say that when I was working for him. There's no tolerance for kiss ass in the military, but now that I'm out of there, I can tell you he was a champion for health care. And when push came to shove and we were fighting for dollars for more medevacs, more helicopters, or more research, or better hospitals, he was on our side every single time. And one time, we had a very difficult meeting where I had asked for several $1 billion for better hospitals. Our hospitals were mostly out of date. And several of the four-stars said to me, Casscels, you are going to cost me a whole squadron, or you're going to cost me a whole carrier battle group. And I said, look, I don't know the merits of the F-22 or how many aircraft carriers we need, but I do know we need more hospitals. We need better hospitals, not more hospitals, better hospitals. And the meeting reached a climax where one of the four-stars said, Casscels, health care is not the tip of the spear. And I said, you're absolutely right, Admiral, rather. I said, health care is merely the vision behind the spear, the muscle behind the spear, and the heart behind the spear. That's all we are. That was the end of the conversation. Bob Gates gave us our money, every single damn penny of it. When he gave me the job 3 years ago, we'd had a stumble or two at Walter Reed Army Hospital. We had several. And he gave me the briefest instructions I think anybody ever had. I went in to see him after I was confirmed by the U.S. Senate and said, sir, I'm just a doctor. I'm not a management person. I don't have a MBA or any of that stuff, Masters of Public Health. I'm just a practicing doctor. What do you want me to do? He was very clear. Hold them accountable. I'm holding you accountable. That's all. That was the whole meeting. I guess that was all it needed, though, because I didn't forget those words. And after a couple of years, I was able to tell him that the military doctors had done their duty and more. Military physicians improved combat care over the past few years with innovations in prevention, getting everybody vaccinated, for example, getting people fit. Training up the corpsmen, so the corpsmen could do much more, the medics and corpsmen could do much more than in previous wars, and teaching every soldier almost to do first aid, combat lifesaver, extraordinarily important, particularly if it takes 10 or 20 minutes for the medic or corpsman to get to the casualty. It may take an hour for the helicopter to arrive. So this combat lifesaver course has been critical. Dr. Gates gave us more helicopters for faster med evacuation in Afghanistan. We fought for more bandwidth. Today you can see we're still a little short on bandwidth, but 3 years ago there was no bandwidth for medical communications. And Dr. Gates supported us as we improved the quality of rehab after injury. But he insisted, we insisted, the military insisted that we set standards, what they call metrics in the military, and jointly monitor outcomes. And that's been done rigorously. The result is that we now have the lowest rate of, the lowest died of wounds rate in the history of military medicine, US or anywhere else. Also, our incidence of disease and non-battle injury are also the lowest that they've ever been. In the military broadly, fitness is increasing, weight and smoking are down a bit, and our heart attack rate is half the civilian sector despite considerable stresses. The hospitals and clinics in the military do not have the volume that some centers do, a center like Mayo or Cleveland Clinic, but there is an insistence on conscientiousness, on competence, on compassion, on confidentiality, on clear communication, increasingly an emphasis on patient choice, which was not previously a feature in the military health system. Cleanliness, comfort. Comfort was not previously something we featured. We're working hard on that. Computability, convenience, courtesy, cost effectiveness. And we're struggling still with cost effectiveness in military health care. But the efforts have paid off, and the TRICARE, which is our insurance system, now has the highest satisfaction of any American health plan. And no one was indicted in the last 3 years, which is always a useful thing in the federal government. Military health care learns a lot from civilians. About 2/3 of the doctors are reservists like me. They have a private practice or a university job. Some of them work at the VA. Some of them work at NIH even. And they bring things. So, for example, one of the things that's been useful has been a single IRB with the NIAID, the National Institute for Allergic and Infectious Diseases. That's accelerated our research. We've also increased our research budget significantly, and we've learned that we have a treasure trove of data in TRICARE, and we've learned to data mine that and to work with the Food and Drug Administration to learn, or to teach, really. What we learn, we teach the FDA about the safety of drugs. We have, frankly, a much larger database than the FDA has and a much more robust database. Let me send a word about what's been done in health diplomacy. In the last few years, the military health system has expanded its efforts in the non-kinetic arena, not just being trigger pullers and breakers of things, but also builders of clinics, builders of schools, builders of relationships, and this has paid off significantly. I can just give you some personal anecdotes, but the vast majority of this has been done by captains working in Afghanistan, for example, who are innovating and reaching out to to the elder leaders in these shura and so forth, and learning from them and teaching them. And this has been a tremendous partnership. The innovation has mostly been at that level, the level of the Army captains, and not from top down. So I can't take credit for it. But let me just say that on one trip to Afghanistan, not being a management person, all I did was make rounds. But at the end of these rounds, the Minister of Health there, Dr. Fatemi, approached me, and this is not a confidential story because he's written it on his website. And he said, "Would you be my doctor?" And I said, "I would be honored." And we started work there, and then he came to Washington. We took care of him. And he went back to Afghanistan and said that the simple adjustment of his medications had doubled his productivity and his endurance and his confidence. And we won a friend for life. Where was he considering getting his care as an alternative before I made rounds with him? In Tehran. In Tehran. The minister from Tehran had come over to visit him. So I pass that on to you because each one of you has that opportunity to be an ambassador, to say to your congressman or to say to some doctor or dignitary you may see when you volunteer in Haiti or in Africa or when you're deployed to Afghanistan, let me be your doctor. I want to take care of you as I would take care of my son. Or if it's an older person, I want to take care of you as I would care for my father. That simple statement means so much. You can talk about heal with steel, but you have to add that other part if you're going to be an ambassador, a champion for peace. Let me mention also other technologies that I think you will understand. We're working hard to develop mobile phone support in Haiti, in Africa, and Afghanistan. Almost everyone in the world now, 5 billion people, have a mobile phone. 5 billion people. And they're learning that these phones can be used for health education, consultation, and gathering of public health data, and for alerts. Let me mention an area where we need your help as physicians, not as surgeons and gastroenterologists, and that's in picking up on signs of psychological distress. We do not have in the military, we do not have in the United States enough psychiatrists and psychologists. And it is the job of every specialist to keep an eye out for the person whose face is long, who's looking at the ground, who doesn't seem to express any excitement about the future, the person who's losing weight. This is a person whom you have to ask directly, are you sad? Is there anybody you would like to talk to in confidence? A chaplain, a psychologist, or a psychiatrist? When I was getting ready to deploy to Iraq, we went through this training where they told you how to survive if you were kidnapped. And I was scared to death. You had to get in a box, and they closed the box, and I was claustrophobic to begin with. I didn't get over that. I went back to the house, and that night, a few days before deploying, I began to have chest pain. This was just 3 years ago. I was 55 years old. And the room was hot. I was short of breath. I was perspiring. I woke my wife up, and I said, "Roxanne, I'm having a heart attack. Take me to the hospital." I've got to go to the ER. I think I'm having a pulmonary embolus or a myocardial infarction. And my wife's lying down in bed, and I turned on the lights. She had her arm over her eyes. She said, "Sweetheart, you're having a panic attack." I said, "What? I've never had a panic attack in my life." She said, "I know, but you're having a panic attack." I said, "Well, maybe so. Maybe I shouldn't go to Iraq. We have 3 young kids, and there's lots of reservists who could go over there and serve. And they're kidnapping doctors over there, and the lucky ones are getting killed rather than kidnapped." It was a very difficult time in 2006 in Iraq, a very dark time. And she said, "You know what? I got 2 things to say to you, sweetheart. You would embarrass the family, the tradition, the example your father set, and the example your sons expect you to uphold. But more importantly than that, the invitations to the goodbye party were put in the mail yesterday. So you're going to Iraq." So I knew then I was going to Iraq, and I could not get over that nervousness. But fortunately, at Fort Bliss, there was a psychologist there who could sense, I think, that I wasn't quite right. And he was a lieutenant colonel, I was a colonel, so he stuck around me and said, just started telling me jokes all the time and talking about previous deployments he'd had and making light of it and making fun of it. Totally calmed me down. I got on the plane to Iraq and was fine ever after. But, you know, you don't know when you're going to reach your breaking point. And let me just mention that I didn't tell that lieutenant colonel, who's now a very famous Army psychologist, Carl Castro. I never told him I was nervous. I wouldn't have told him for anything. But he was a good doctor, and he sensed that, and he helped me enormously. So I know very well what some of these stresses are like. Let me mention another area where we're struggling, and that is in electronic health records. And those of you who, I know you're primarily proceduralists, but we need you, the medical profession, the U.S. and the military, we need you to help us troubleshoot these electronic health records and tell us what you need, because we are still struggling to get the electronic health records that we need. Well, in short, thanks to many people in this room, we have a medically ready force and a ready medical force, and this is no small accomplishment, and I'm very proud to have been the nominal leader of that effort for several years. Let me mention also something I'm very proud of as just a regular doctor, and that is the economic importance of what we do. I've alluded to the fact that each of you can be a champion, not just for the patient to whom you're dedicated that hour, that minute, that day, but more broadly, the unsung impacts of what you do for world peace in the patients you train, in the patients you care for, and in the students you teach. Many, many times when I'm in Africa or Middle East or Asia, a doctor will say to me, you know, I'm now the minister of this, or I'm now a member of parliament, but the happiest days of my life were when I was training in Chicago or training in Boston, or when doctors from the Army or the Navy or the Air Force trained me here in Bangladesh or in Burma or in Thailand. It's absolutely extraordinary how often that happens. So these trainees, whose names you probably can't even remember, that you trained, are now in positions of great authority, either as leaders themselves or as caregivers for leaders. This is a tremendous force for the United States, for our image. Let me mention also, some of you know this, but in the last 200 years, we've seen a 100-fold increase in the productivity of Americans. So the GDP per capita has gone up 100-fold in the last 200 years. That's more than in the previous 2,000 years. Well, you all know this, the Industrial Revolution, the Information Age, and so forth. But recently, a group of healthcare economists have calculated that half of the increase in U.S. economic productivity, half of it, is due to improvements in medical care and public health. Fully half of it. And that's because mostly of the increases in life expectancy and the decreases in morbidity. In 1900, a baby girl, a newborn girl, had an average life expectancy of 40. Today it's 83. So obviously in her lifetime she's going to achieve much more, and she's very likely not to be hampered by chronic disease until she reaches old age. This is a critical observation because as we are faced now with healthcare reform, proceduralists in particular are challenged. There is no doubt cardiologists like me are facing a 30% cut in income. I imagine the gastroenterologists are facing some cuts as well. The healthcare reform law we have now is complex, it's costly, but it is moving us to a new era of pay for prevention, pay for performance, a focus on disease management, and we're going to have to make the most of it. I would put it to you that if we focus on the quality of care for the whole patient, patient satisfaction, that we will do better than if we do not. If we work hard to eliminate errors, increase our focus on prevention, we will do much better than if we do not. Let me tell you a brief story. A 49-year-old doctor went in for a routine colonoscopy. Colon was normal, 100% of it. The gastroenterologist, a thorough fellow, also did a rectal exam, described a prostate that was irregular, asymmetric, firmness on one side of the gland, not on the other. This was all in the report. It was not in the conclusion. What happened thereafter? The internist read the conclusion, normal colon. Neither the internist nor the gastroenterologist shared the report with the patient. The patient would likely have read the body of the text of the report, which described what sounds like a prostate cancer. The patient, being a doctor, would have done something about it. But there was this failure to communicate, this failure to include the patient. And let me tell you, these two doctors who I actually know are two of the best doctors in one of the best hospitals in this country. That patient went on to have some symptoms. A few weeks later, had a pelvic rectal CT, and an abnormality was missed by the radiologist, a superb radiologist. The patient asked for a PSA. The internist said, "You don't need one, you're only 49. We have these guidelines." Well, the guidelines were for asymptomatic people. If the patient has symptoms, you get pelvic symptoms, you should get a PSA. Anyway, the sum total of it is that the patient was allowed to drift along, and a year later presented with widely metastatic prostate cancer, stage 5, PSA 100. disease in the liver, the bones, the lymph nodes. And this was all because extremely good, highly reputed, conscientious doctors were only human, had made some small mistakes. In this particular patient's case, they all added up, and lightning struck 3 times, 3 mistakes, and the guy was faced with years of chemotherapy. I'm familiar with that case because I'm the patient. And here's one of the difficult things. I've never confronted these doctors about this. They reported to me as vice president of the university. They were my friends. I think the world of them. And it's so difficult to ask tough questions of your doctor. And here I am, a doctor and nominally the supervisor of these well-known specialists, and I didn't have the nerve to say, what happened? What happened here? I just went on and got my chemotherapy and my surgery and my hormonal therapy. Well, I've been blessed. I'm here 9 years later. I'm in my 10th year of metastatic prostate cancer. There's been a silver lining, but Lord knows I'd be happy to have just seen the video and not been through it personally. So I put it to you that even the very best specialists, the best proceduralists with the highest volumes and the best outcomes are challenged when it comes to being complete doctors. And this is what we're going to have to be. This is the era we're entering into. This new world of healthcare reform is going to be a big, big challenge for the proceduralists. I'm sure we can meet it as one proceduralist to another. I think we can meet it. I hope we can meet it. We have to meet it. It's going to take some nerves. We're going to have to discipline ourselves. We're going to have the nerve to discipline bad doctors. We're going to have the nerve to stand up to people who want to slash at our budgets randomly. We're going to have the nerve to approach our congressional leaders to fight for what is right. So let me add a wish for you, in addition to your motto of heal with steel. I think we can do that sometimes, but nerves of steel we are going to need every single day in this next decade of healthcare reform. I wish you all luck. I thank you for your service, particularly the guys downrange who are listening in. I know we've got several listening in Iraq and Afghanistan. We really are grateful to you beyond words. Thank you very much, Rick.
Now I can see you. You can tell how we've had great leadership here, allowing us to move forward and make the advances during his watch, as he indicated, improving the care within our military health care system. Dr. Casscels, thank you so much for your service to your country and the service to our soldiers. Now I'll turn it over to Steve, and he will continue the meeting.